women who deliver at health facilities is low, and this is one of the major contributors to the high maternal mortality and infant mortality rates in Uganda. The current maternal mortality is estimated at 438 deaths per 100,000 live births, and the under 5 mortality is estimated at 55 per 1,000 live births. Consequently, Uganda's commendable efforts in achieving the concluded Millennium Development Goal 4 on reducing the under 5 mortality rate by 2/3 is threatened as the country focuses on achieving the Sustainable Development Goal 3 on good health and well-being. For this to happen, there is need for integrated high-impact solutions to some of the health-related concerns, like through use of the scorecard.
It is kind of an innovation, the way it is presented, the way it is put. It is in a way that it can be used and interpreted easily.
So the indicator, as you see the scorecard, helps people to know, first of all, where they fall in terms of performance for each given indicator. Red is doing badly. Yellow is above average. Green is doing very well.
So if there are health facilities that are not performing well in a particular area like immunization or antenatal care, they can quickly see those that are in the red, or are they in yellow, or are they in green.
For instance, if you're talking about immunization, how many children are being immunized? If you have a cohort of 1,000 children, if they're immunizing only 600 out of 1,000, what are the bottlenecks? The bottlenecks can be related to lack of human resource. There are not enough nurses out there to immunize, or they're not conducting enough outreach sessions to the hard-to-reach areas to immunize all those children that have been left out, or there's stockouts of vaccines, so they don't have enough stock to immunize the children that come in, or else it might be something to do with behavior at the community level. The mothers may not have information about the need to come back yet again to receive another shot for the baby, and yet again until the child is fully immunized.
The scorecard is developed around the life cycle of a woman to include pre-pregnancy, pregnancy, delivery, postnatal, newborn and childhood areas, and presents data by use of 3 color themes: red, green, and yellow. The scorecard is a shift from the detailed statistical presentation of data through graphs, charts, and percentages, some of which are not easily understood by all stakeholders.
We now ask, why is it red? Why aren't you coming back? Until we get to the root cause, then we generate evidence-based work plans that are very smart, and we share with the different implementing partners.
We are using the scorecard at health facility level, at the district health team level. We are now also using the scorecard at community level. So with all those levels having different educational background, you must have a common tool that is understandable by both.
It has been well integrated into the health reporting system in the country. So it's automatically generated in our health reporting and management information system, also known as DHIS2. So at a click of a button, the district health officers can see their scorecard for the district, how they perform across 24 indicators related to maternal, newborn, child, and adolescent health.
If all the users are knowledgeable, they are sensitized and can interpret those colors, then if it is the community, they will start questioning the service providers. But how come in our district or in our sub-county, for us, we are red in this indicator? Why?
Working with communities and with health providers, we are able to identify these bottlenecks and identify actions to be able to address the bottlenecks.
At the health facility level, a continuous quality improvement scorecard tailored to improve the quality of service delivery at these facilities is in place and has been used to aid evidence-based planning, monitoring, and implementation, as is the case at Nachifuma Health Center 4 and Katogo Health Center 3.
Now that the obligation of the whole facility staff and the any stakeholder to see that we work upon improving those red indicators which are on the scorecard.
So, as you rate yourself, as you get feedbacks from those communities, they'll also give you an input in how you can really perform better.
If we are to mobilize resources, to market our situation and we mobilize resources, we need to adopt a friendly way of marketing our issues. And one of them is scorecard.
The districts will use the scorecard to evaluate where they are in terms of performance and why aren't they getting there, and come up with activities to address the bottlenecks so that they can perform better in the next quarter. So systematically going through this process every quarter is every 3 months.
Whereas the scorecard is arguably a great tool in planning, monitoring and implementation of reproductive, maternal, newborn, child and adolescent health, as well as helping health officials set priorities, its continued use and appreciation by all stakeholders is incumbent upon each of their commitment to addressing the information it presents.